Good evening. I'm Dr. Leela Mohan here. I'm MD physician. I'm practicing in Columbia, Asia and motherhood, and I have my own center at HSR, that is Padidam Healthcare, that is located in Bangalore, 27th May. Today I'm here to talk about the regular blood test for the healthy heart. As we are aware, the number of illnesses reported today in people is increasing at an alarming rate. Some of these illnesses can be serious if not identified at an early stage. We all know we have to identify the diseases before itself. So, a blood screening can provide a snapshot of your current health and catch potential health problems before they fully arise to the surface. So, they can be managed most effectively. So, but this is not enough. After diagnosing with certain condition, it is also important to do regular blood tests. So let us see why it is important to do regular blood tests. So basically, regular blood testing is one of the most important ways to maintain overall physical well-being. In fact, being tested at routine intervals will help you to understand how your body changes over time and allow you to make timely decisions for betterment of your health. So blood tests have a variety of uses. If one is experiencing unusual persistent symptoms, for example, fatigue or abnormal weight gain or new pain, blood tests can help to identify cause of that condition. Also, if one wants to optimize their health, knowing levels of various blood components such as cholesterol can help to tweak your diet or fitness plan to minimize unhealthy habits. So before moving on to these conditions that require blood tests, so let me give you some information that you may need to know prior to the blood test. So generally, the majority of blood tests don't require any specific preparation and take only a couple of minutes. But sometimes healthcare professional like doctor may tell you whether there are anything specific instructions you need to follow before your test, such as avoid eating, that you should be in fasting for the whole night, the time period of fasting, like how much time you have to be on fasting, certain things. These are the general prayer instructions. As avoid eating or drinking anything apart from water, that is called as fasting, which will be up to, like as I said, it will be like up to 12 hours. So it is essential to follow the instructions given. So let's look at some regular blood tests which are regularly conducted. So checking your blood pressure, that is the main thing. So blood pressure is one of the easiest and simplest diagnostic tools which can tell so much about the current and possible future health. It is the only way to know if one has high or low blood pressure, which at the end helps in controlling the blood pressure. Blood pressure is the force of the blood against the walls of your arteries as your heart pumps it around your body. It is expressed in two numbers. The upper number is called as systolic blood pressure. It is a pressure in your blood vessels when your heart contracts, whereas the lower number is called as diastolic blood pressure. So, which means the pressure in your blood vessels when your heart rests between beats. So what is the normal blood pressure of an adult? When we are at rest, it should be less than 120 or less than 80. The 120 is the systolic pressure. The diastolic pressure is around 79 to 80. So if your BP level is more than 140 by 90, then it has to be considered as high blood pressure. That is called as hypertension or nothing but blood pressure. So in fact, it is possible to monitor your blood pressure outside the clinical setting also, or at home using a blood pressure monitor. As we all know, to measure the blood pressure at home, one can either use an Android monitor or digital monitor. So generally, the finger and wrist devices do not always get a correct measurements. So we have to remember these things. So the doctor will advise about how long one should monitor blood pressure. So however, we often ask to check the blood pressure for 7 consecutive days. On each day, one should monitor blood pressure on 2 occasions. That is in the morning between 6 a.m. and 12 noon, and again in the evening between 6 p.m. and midnight. Each time one need to take a minimum of two readings, leaving at least 1 minute between each. If the first two readings are very different, then take 2 or 3 further readings. So it's important to know that your blood pressure may go up or down depending on your age and heart condition, emotions, activity, and the medications which you take. So moving on, now let us know about the regular checkup for blood sugar level also. So checking the blood sugar level, diabetes is a condition that affects the body's ability to either produce or use insulin, which helps the body utilize the blood sugar for energy. So diabetes results in blood glucose that raises to abnormal high levels. So the type 2 diabetes can affect every body part from your eyes to feet. There are different complications like microvascular complications and macrovascular complications where the person who is suffering with diabetes can experience these symptoms. So checking again Hba1c test. These are the blood tests which we'll do fasting blood sugar test and oral glucose tolerance test. When we come to the Hba1c test, the key blood test measures the average blood sugar levels over the previous 2 or 3 months. So and helps doctor know how well your blood sugar is being controlled. So you have these checks every 3 months once when newly diagnosed and every 6 months once when you are stable. So the fasting blood sugar involves having your blood drawn after you have fasted overnight, which usually means not eating for 8 to 12 hours. So the oral glucose tolerance test, this test takes place over the course of 2 hours. So your blood sugar is tested initially and then you are given a sugary drink. After 2 hours, your blood sugar levels are tested again. So check if you have lost any feeling in your feet, and for ulcers and infections. Check for damage to blood vessels in your eyes and also for high blood pressure, heart and kidney diseases. So these are the self testing of your blood sugar which can play an important role. And for people with diabetes, the blood sugar readings should be as follows. Like fasting, it should be 80 to 130 and 2 hours after taking meals, it should be below 180 and Hba1c, it should be less than 7. And again, in the blood test, we can monitor the blood cholesterol levels as we all know due to lack of physical activity and other things. And then we develop cholesterol levels spiking up in our body and without regular physical activity and good eating patterns, all these things will lead to high cholesterol levels. So what all we'll see in the blood? Like we'll see total cholesterol, low density lipoproteins, high density lipoproteins, and etc. So the total cholesterol, this is the most amount of blood cholesterol content. A high level can increase your risk of heart disease. The total cholesterol should be below 200. So the low density lipoprotein cholesterol, that is, this is also called as the bad cholesterol. Too much LDL cholesterol in blood causes fat buildup in arteries, so which reduces blood flow and lead to major heart complications. So the LDL cholesterol level should be always less than 130, and which will be help in desirable levels if it is under 100, that we can prevent all the heart attacks and other such heart related conditions. So in people with the highest risk of heart attacks, the recommended LDL level is below 70. The high density lipoprotein, that is called as HDL cholesterol, that which we'll call it as good cholesterol. The HDL cholesterol level should always be over 45. That is, whereas women should aim for an HDL over 55. So the another blood sugar levels, that is sorry, it's not blood sugar, blood cholesterol levels, that is triglycerides. The triglycerides are another type of fat in the blood. So high triglyceride levels usually mean you regularly eat more calories than you burn. So the high levels can increase your risk of heart disease. So your triglyceride level should be less than 150 milligram per deciliter. So this is how we have to check the sugar levels and the cholesterol levels, all these things. The bottom line is that the blood offers many clues about your health. So they are also a good way to catch illness or disease early or see how well your body responds to treatments for various conditions. At last, I like to suggest that get routine blood tests done at least an year. Thank you.